So we're doing a clinical spotlight series here at Prosper Natural Health on fish oils today. This is our doc talk of the month. And so we are a team of naturopathic physicians here in Washington State, a beautiful town of Port Townsend, and myself, Dr. Rosalie de Lombaert, as well as our clinical director, Dr. Molly Force, here at Prosper Natural Health. And we are licensed physicians in the state of Washington, which just means we've gone through four years of medical school, and keep up with our licensing requirements, of course. And what we like to do on the monthly here is present these doc talks on essentially a question that we've seen in our patient base that ends up coming back frequently. And so we try to stay up to date on these big questions that patients have brought to our attention. And so the one today is on fish oils and an update on fish oils, specifically a clinical spotlight where we dig into the primary literature to see what all is new on this topic. So there's a free online class with us each month, and we do record these and send these out after the fact. So if you are watching remotely or can't make the exact time, those are always available in the education tab of our website. So clinical questions for today that have got our minds going are, what is fish oil? What are the contents? It's more than just an omega-3 oil. Are there any quality concerns with fish oils? And what's in the primary literature? Which conditions are best supported with fish oil intake? And are there any adverse effects upon supplementation? So if you stick around, we will answer all of these questions for you. So let's hop right into our very first original research here. So 1971, there was some Danish scientists who found that the Inuit community in Greenland's northmost coast had an exceptionally low level of heart disease and diabetes. And so they thought, okay, well, let's do a dietary analysis of these native peoples. And they found that they are eating a lot of fish. And so they presented this paper in the Lancet, a really well-recognized medical journal, that said, okay, this high amount of fish oil in the diet is the answer to heart disease and preventing heart disease. And so that was kind of the first article that got people and scientists and anyone health-minded excited about fish oils specifically as a therapy. So fast forward, gosh, going on 50 years here, the meta-analysis from 2018 that looked at fish oils as a way to prevent cardiovascular disease. So a meta-analysis is a review of all of the trials that they can find, the scientists putting this together, all the trials that they can find that have this question at its core. Do fish oils help prevent cardiovascular disease? So the meta-analysis looked at hundreds of trials here to see what is the conclusion. And this meta-analysis found that as a preventer of cardiovascular disease, it was not very reassuring that fish oil was excellent at preventing cardiovascular disease or diminishing mortality in general. So we see this and we wonder, it's in stark contrast to that 1971 paper. And so what we want to do today is really parse this out and dig a little bit deeper. It's definitely more than just about cardiovascular prevention. So digging a little bit deeper, the good, right? We've got to think about fish oil as being a really robust source of omega-3 fatty acids. Omega-3s are incredible anti-inflammatory molecules. We'll talk about this in depth later, but at its essence, we've got to think about omega-3s in general, amazing anti-inflammatories. So thus, inflammatory disease of all types can benefit from a higher omega-3 ratio in the diet, and that's where fish oils come in. The bad of fish oils is this very real reality of global environmental impacts. The fish oil industry being a billion-dollar supplement industry, we can't underestimate the power there in terms of the research studies that get put out and the big marketing behind this. And then secondly is that overfishing being at a global all-time high, part of this overfishing is indeed also this fish oil industry. Another piece here is there are side effects and adverse effects of consuming fish oil. So we'll parse through all of this even deeper in these coming slides.
So let's talk about what it means to be an essential oil. So when you hear the word essential, you think required. So truly, these essential oils, these essential fatty acids are required for life. So in order to live and survive, these are required. Now, we might be thinking, what is the source that these fish are getting these essential oils? Because these fish are not just creating these on their own. These are also essential oils that they have to ingest in order to survive. And then we're taking that oil from the fish and gaining the benefits from that. So we actually see this start with a picture of algae. Now, algae is going to be able to eat and ingest nutrients that are in its environment, whether that be in a pond or in the ocean and salt water. And then it ends up being a food source for much bigger creatures. But we start small first and we go to the things like the zooplankton. And that includes our krill, which is one of the largest zooplankton out there. As far as that goes, then the krill and these other smaller little crustaceans get eaten by the fish, and that is where we get these essential fatty acids for the fish. And they might also be eating the seaweed and the algae directly as well off of the rocks and the coral. So this is how this food chain can be followed. And this is important when we want to think about sourcing these sustainably and thinking about how this is mirrored both in a saltwater environment as well as freshwater and even on land, because these essential fatty acids are found and required not just for us as humans, but for fish and all animals. So when we think of these oils, it's important also to understand the different types of oils. We're going to break these down simply into, we've got saturated fats. You can see these over here. And these are the ones that are going to be solid at room temperature. So we think about those being found in things like our dairy, our eggs, our red meats, even coconut oil that's solid at room temperature is going to be a saturated fat. Then we have our monounsaturated fats. Those are the omega-9s, and we think about those being in some of our fruit oils like olive oil, avocado oil, and some of our nuts. Then we get into the polyunsaturated fatty acids. We shorthand those and call them PUFAs. It's a great name. So these PUFAs can be broken into omega-3s and omega-6s. And today we're going to be really focusing on the omega-3s, which are the beneficial components of our fish oil. But we will be mentioning the omega-6s because there's a very important ratio that's been very well established in the medical literature as being one of the dominating effects on whether we have inflammation or not, that comes down to these omega-3 and 6 ratios. So when we're thinking about the omega-3s, this is where our fish oil lands. We also see that algae is going to land here. Remember, algae is that food for the zooplankton, the krill, and the shrimp, and the food for the fish. And then we also see linseed. The other name for that, you guys know, is flaxseed. So these have our fatty acids that are omega-3s, these PUFAs. And then the omega-6s are found in some of these other seed oils. You guys have heard of these. They're in a lot of food ingredients: sunflower, safflower, canola oil, soy oil. These are going to be our omega-6s. Now, the American diet is very dominant in that omega-6 side and very low typically in the omega-3 side. And that becomes an issue for us. So let's talk about that a little bit. Our omega-6s versus our omega-3s, this is the chemical pathway. And what we want to point out to you here is we start with the linoleic acid, the LA, for omega-6, and then it gets converted into arachidonic acid. Or we might eat a food that feeds directly the arachidonic acid pathway. And an example of that is our red meat. Now, that's one of the reasons that red meat gets kind of a negative bent in the research world and in some of the medical community. So what happens is these omega-3s go through and they provide the building blocks for a chemical cascade that leads to pro-inflammation, more inflammation building. Okay, you can see these prostaglandins, these leukotrienes. These are the chemical structure names that we, as scientists, provide for identifying the type of inflammation that this system causes. Omega-3s, on the other hand, we start with the alpha linoleic acid for things like our flaxseed. Okay, this ALA, different than the LA. And this omega-3 can be converted in the body, but it requires an enzyme in which to do that. Now, some people genetically do not have that enzyme. So that becomes a problem if, say, they're choosing to have a primarily vegan diet or not having a diet that is rich in the marine foods that provide these EPAs directly, these fish oil derivatives directly. And the reason for that is if they cannot convert that ALA over into EPA, they get stuck. Okay. And then they don't get all these benefits of this anti-inflammatory cascade that we see down here. Now, with the EPAs, they're also divided into, these omegas are divided into EPA and then DHA. And we're going to talk more extensively about where those are going to have effects on the body. But that's really important for us to understand the ratios between those and what we're choosing to put in our body if we're choosing to supplement with these. This is another very complex biochemistry page that we wanted to include for you guys just to show you omega-6 side. Boy, look at all that red. That's pro-inflammatory. We don't want to be eating just a whole bunch of these processed seed oils, is the takeaway from that, versus our omega-3s. Wow, look at all that green, inflammatory, resolving mediators that are being, made by that. We want to be making sure specifically that we're getting the EPA and the DHA. And here you see, note that the ALA, that flaxseed alone coming in and not being converted over, is not going to provide us with the inflammation resolving pathway. We have to be able to convert it, okay? So that's where taking directly the algae, the krill, the fish provides the EPA and DHA directly. Okay, so now we have an understanding of omega-3s versus our omega-6s. But then we want to think about within these omega-3s, because we've already kind of talked about the ALA needing that extra conversion step. There's more than just flaxseed. We also find this in chia seed. Most of us have tasted chia seeds. We can find small amounts in walnuts. They're also going to have a fair amount of omega-9 in there. And hemp seed is also, and hemp seed oil is also going to be an option. Now, ALAs and the EPAs and DHAs have a high chance of oxidization. That means that they can go rancid very easily. So we want to make sure we're storing these in cold places. If we're choosing to use the seeds and the nuts, we want to make sure they're refrigerated and not pre-processed or pre-ground, sitting on the shelf for many days or months before we purchase them. So buying them whole and grinding them fresh. Now, when we're thinking about these long chain fatty acids that are omega-3s, that's the EPA and DHA. We find those not just in our algae and our fish, but also technically we find some of those in our pasture-raised eggs and our grass-fed ruminants. That means animals that roam around that are grass-fed. Now that's different than our soy and corn grain-fed animals, ruminants, and chickens that are not being allowed to pasture. And the reason for that is once again, these omega-3s, these essential fatty acids, are being given to these animals by their food source. So we always like to follow up the food chain. So it's just another plug why to try to purchase foods that are more in line with natural ecologic systems and food chains when it comes to getting the full breadth of nutrients from our food. Now, remember when we said that these are essential fatty acids? The reason for that is these make up our cellular membranes. Well, you can imagine cells are pretty important for us to have structure, right? We all got to have cells, and we need to be making sure that they're able to allow certain things in and certain things out, okay? So these have to be semi-permeable membranes that have structure to them. And these are made up in a major amount by our fatty acids. So if we have a dominance of omega-6s, they're going to go in and fill the place. They're essential fatty acids. But we want to have more of these omega-3s making up our cell membranes. And that's because these fatty acids also are going to provide us with an oxidative stress reduction. They are strong antioxidants. What we mean by that is they calm down, they quell free radicals. When we think about free radical damages and oxidization in the body, we think about cellular damage. So I always like to use this analogy of a toddler running through the room, because I've got young kids, ripping things apart. That's like a free radical. That's like damage being done to the cell. And we want to donate it a hydrogen, give it a calming, reducting factor by giving it an antioxidant. And that's one of the things that these omega-3s do. And we also know that omega-3s affect how our genes are actually expressing, and that's a huge deal. So not only are they essential in providing structure to our cells, every single beautiful cell, they also help protect those cells and then tell the genetic material around them what to do, which is cool. So when we think of where do these omega-3s benefit us, a lot of this question comes down to where do you have really important cells? So as we can see, brain is going to be a big deal, and a lot of fat deposition goes to brain. We know eyes are going to be a big deal. How we're thinking, so mood as well as cognition, is dealing with the brain piece. We know that it affects our cardiovascular health. We know it affects our joint health, our bone health, our immune response. It affects our cancer risk, and it affects our inflammation, our sleep, our lipid levels, our, cholesterol and triglyceride levels. And then you can see, I like this little pictograph on the left because it shows with these colors in orange, this is where the DHA form of these omega-3s are going to have the most impact versus the red, which is more the mind boosting and triglyceride levels. Those are going to be more affected by the EPA. And then we know that a combination of DHA and EPA helps those green zones. So that's potentially heart, joint, immune response. And we're going to talk more about heart. There's some nuances there with cardiovascular health. But when we think about the eyes, which are so close to our brain structure here, and our brain, we're really thinking, wow, DHA is critical. And we're thinking about this in a big way because we see the medical literature support that when we're in utero, we need that DHA for our brain building, and we continue to need it as we go through our growth process, our learning process, and as we age.
So what about the side effects of fish oils? Dr. Molly talked about all the really amazing nuances of omega-3s, and specifically the DHA, the EPA, the combo of both. But what I often see in my patient base is that patients will come in just on a fish oil because they've heard that it's good for them. And so this is a big conversation we have with patients as we're talking about, what is the use of this supplement oil for you, this supplemental fish oil. And sometimes they don't realize that some of the side effects or the complaints that they're having are actually from the fish oil. The number one side effect I see from this, especially high dose, long-term supplementation, is diarrhea, GI upset. It's almost as close as 25% of people who are on fish oils will experience this side effect. So if you can imagine, you're adding an oil to the body, and if your body has a hard time digesting oils, it's coming out in the stool that way. Sometimes this GI upset can be more than just diarrhea, but can be nausea or heartburn or just abdominal discomfort as well. This is one of the big interventions I have for my chronic diarrhea patients. I pull them off of their fish oils to see if that might be the culprit ultimately. Secondly, and this is something that you're probably familiar with if you've had a surgery at all, is that fish oils can contribute to bleeds and bruising. This has to do with that they are antiplatelet, especially at high levels. And so again, my high dose fish oil folks prior to a surgery, we definitely pull them off of these fish oils. Lastly, a piece that I don't see mentioned often enough is the possibility for heavy metal poisoning. Again, when we think about high dose levels over a long period of time, the FDA does have in place a protocol essentially for diminishing those heavy metals. So part of the purification process of fish oils involves removal and detection of these potentially. But the thing is that again, it has to do with high doses long term. I don't think that's yeah, I end up wondering about it over time, since I know that there's a lot that can build up in the oils of fish from not just mercury, but arsenic, plastic byproducts, etc. So this next slide tells us about a recent, again, meta-analysis on the safety profile of fish oils. So again, remember that meta-analysis is looking at everything out there in the primary literature that has this question at its heart. And so the biggest safety risks that they found here was that higher odds of diarrhea for patients or participants that are taking fish oils, or ultimately they expanded it to omega-3s. A higher amount of folks had dysgeusia, which is just like a sense of taste change. So whether it's a bad taste in their mouth or a fishy burp, that is often one that I see as well in my in my patient base. Increased bleeding tendency. But the side effect that was noted, that was a positive side effect, was lower rates of back pain. So it's just worth thinking about, again, as a combination of things, just not as a cover-all treatment. So how much fish oil is enough? This is a big question, and it has to do primarily with quality. So what does your fish oil actually contain? Is it low EPA? Is it a low DHA variety? Is it a mixture? Is it not even reported? I would sort of raise my eyebrow at a supplement that doesn't report the percentage of EPA and DHA that's in it. So here on the right-hand side, we see, okay, 500 milligrams of EPA, DHA daily. Best source of that ends up being fish oil, but you can also get it from algae oil. That's the amount to avoid deficiency, to essentially help correct the omega-3 to omega-6 balance, which at the end of the day is the most important thing. 1 gram of these a day is more for proactive support. Okay, there's some inflammatory things going on, maybe a recent pulled muscle, something like that. Okay, let's do some inflammation support. 2 to 4 grams of the EPA and DHA is for kind of high intensity support. Like, all right, we've got an autoimmune condition that's really ramped up. We've got to ramp down that inflammation pretty quickly. So that's kind of gives you a ballpark of quantity. So quality here, like I mentioned, has to do with how much EPA, how much DHA. Is your fish oil reporting it, or is it at 30% or less? I'm not certain that would be your best choice. I would want a higher essential fatty acid combo there. Also worth noting is that these fish oils will expire fairly quickly. The literature says at least within 2 years is kind of their expiration date. So sometimes I see folks who have fish oil in their fridge for a long time and continue to take it. At that point, you're starting to play with potential for rancidity. And if you're intaking rancid oil, you're causing more inflammation. So I always recommend patients to keep their fish oils in the fridge or the freezer, especially if they are planning to use it for a longer period of time. And just check those expiration dates to make sure they're not within the next 6 months or something. Source is huge here. Is it an aquaculture kind of farmed fish variety, or is it truly wild caught? The label has to mention it's wild caught. Wild caught is like pastured or free range chicken and eggs, right? The fish are able to go around and eat the algae around them instead of being fed grains or soy or essentially omega-6 containing foods. Whole fish versus a blend ends up being very, it's kind of up in the air. There's just a lot of products out there, from krill oil to cod liver oil, that are just specific to that species versus a blend that has a combination. The blends I see more related when they're trying to get more DHA content, like a high DHA fish oil would probably be a blend. And so that's just something worth considering, very much patient specific. And then lastly, again, this quality piece, fish oil being a potential source of heavy metals, especially high dose long terms. There are reports increasingly of PCBs, those very small microplastics, ending up in the oily parts of the fish. So, we think about fish oils. Is it worth supplementing? Can we just get this from our diet? And again, it's a very individualized discussion. I think there's a lot to be said about getting the whole fish. There's so much more to the fish than just its oils. You eat the whole fish, you get the proteins, you get the additional micronutrients there. The fish oil just being an extract, its use is primarily anti-inflammatory. So I'm always in favor of trying to pull from the whole source. And then I'm also in favor of, if we need to pulse in a fish oil use for a high inflammatory condition, it's totally appropriate to do both at the same time.
So let's jump into the actual literature here. We tried to go through and really see what was going on currently. So at the beginning, we introduced this study that came out in 2018 that was kind of scathing about fish oil and if it actually helped cardiovascular disease. And that's something that many of you might feel like you're almost having whiplash with fish oil in the media. You'll hear like, oh, it's good for this, it's bad for that. Like I remember a few years back, there was a big splash, bad for prostate cancer. There's very confusing, like, is it good? Is it bad? That kind of thing. What we see currently for this is a study we pulled from 2024, so this year. So that's, 6 years difference in that study that said, oh, it doesn't seem like it's helping. Is it does look like our omega-3s, as we would expect them to, as anti-inflammatories, are beneficial for cardiovascular health. And additionally, if a person has high omega-3s in their tissues, then that's associated with a lower risk of developing cardiovascular disease. We also see that it appears that the EPA component of the omega-3s is the most critical for the cardiovascular system versus the DHA. And so this study was suggesting that the prescription grade EPA only formulas in the studies tend to have a greater benefit from the omegas that are combined. Now, it's also important to think about with these studies, what kind of oils are they using? Are these, older fish oils? Are they rancid? What type of fish were they extracted from? All of this kind of piece. It's important to think about quality as well with some of these studies. So it gets hard to blanket everything else, but it is nice to look at some of these meta-analyses. This study was actually done in 2022, and I think it was really cool because in between that time period of 2018 and 2022, they were able to understand the chemical reactions that happen within the body from omega-3s, and they were able to give these specific chemical uh, components a name, and a lot of them are named resolvin. So there's many different subtypes of resolvin that they have now found. And these help us understand what action these little chemical anti-inflammatories, the omega-3s, are providing different tissues. And there's tons of study going on trying to understand more about these different resolvins and really dedication to understanding how certain tissues are affected by them. We see very significant evidence that fish oil is anti-inflammatory, and we can see why. That's one of the cool things about this study is they really broke it up and they said, okay, look, you get more anti-inflammatory genes that are expressing, so that's a good thing, and we have less of these cytokines that are really inflammatory that are being produced, and then we have more of these resolvins, the E series and the D1 series, being created. So that's really awesome seeing, okay, we know anti-inflammatory, check. This is going to be helpful for our cardiovascular system. We know that it improves because it's an antioxidant. Remember, it's going to reduce those free radicals and the cell damage. It helps improve the endothelial function. Now, endothelial is a fancy name for the inner lining of the tubes that are our vessels. So this is really a big deal. It helps with nitric oxide production, that helps us dilate those vessels, that helps reduce things like high blood pressure, hypertension, and it helps clean up damage that might be happening within those vessels, which is going to reduce theoretically more of our atherosclerosis and potential for clotting and filling and narrowing of those vessels from plaquing lipids. It also provides, these omega-3s provide an anti-thrombotic activity. That's because of its effect on platelets. Like Dr. Rosalie was explaining, thins the blood. That can be very helpful for some patients who need to improve blood flow. It also has been shown to reduce arrhythmias, so abnormal heartbeats, and can help regulate the autonomic nervous function. So that's our parasympathetic nervous system. That's the one that says rest and digest. It's a big deal. That can regulate some of how fast our breathing and our heart rate is. We also know that fish oils have an effect on ventricle remodeling. So that's actually the shaping of those segments of our heart. That's a big deal. And then also we know that it affects lipid metabolism. So that's where we're looking at the cholesterol, that interaction with the cholesterol and the liver and the blood vessels and that circulation.
So this section on, that where we dig into the research articles is just it's just a way to kind of give you guys the information that we're seeing in the primary literature. So again, it's really interesting to note the negative studies, the positive studies, and what's clear is that a healthy patient doesn't necessarily need fish oil, but a patient who's looking for cardiovascular support post heart attack or with some ventricular changes or needing endothelial support within their cardiovascular system, there's totally a use for fish oil there. And same thing here with arthritis. Another inflammation pathology of the joints is just, again, this meta-analysis, high level of scientific data showed us that, yes, okay, compared to placebo, supplementation of omega-3s in general is effective to relieve pain and improve joint function. So an underutilized, in my opinion, an underutilized treatment for our osteoarthritis patients. Here, fish oils with autoimmunity, specifically rheumatoid arthritis. Again, consumption of omega fatty acids, omega-3s, was found to significantly improve 8 disease markers, right? Things like CRP, or an inflammation marker you could test in the blood, rheumatoid factor, right? So it was shown to improve these. This specific study was looking at inflammation specifically, and of the various markers of inflammation, leukotriene B4 was significantly decreased. If you go back up to that slide 11, you'll see under that omega-6 pathway, you'll see that leukotriene B4 with a big red circle around it. It's one of our highly inflammatory omega-6 derivatives.
When we go and look in the literature about what's happening with the brain with omega-3s, there's tons of information. And this was just a cool study. It was 2019, but it was talking about how we've really established that one of the things that these omega-3s is doing is helping with neurogenesis. So that's building. We need brain building. This is great. It also helps with neurotransmission. That means signal getting from point A to point B. So that's cognition right there. That's executive function right there. We need that. And then neural inflammation. So when we're dealing with potential inflammatory damages or degeneration of the brain, this is where it becomes protective. And then there are specific brain disorders and imbalances in the mental health fields that we know that can produce support from having those omega-3s. So it's not just our, dementia sort of category that we're thinking about for things like neurotransmission, but also things like our bipolar disorder, schizophrenia, our ADHD, our autism. So there's a bigger group here. And then there's quite a bit of literature on depression and anxiety as well. So we want to be remembering this as a strong supportive for brain health, specifically those DHA versions.
So here, a study on fish oils and eye health, especially inflammatory eye diseases. The ones they looked at specifically were dry eye and macular degeneration. And so this is a really interesting study that really highlights those pro-resolving mediators, which you heard us talk about a little bit beforehand. So if you look to the right here, that essential fatty acid, alpha-linolenic acid, omega-3, gets turned into EPA and DHA. And there's another step beyond that that is kind of new that's been uncovered recently, is that these EPA and DHAs actually contain what are known as specialized pro-resolving mediators. So the supplement industry is now able to extract these from the fish oils, and they're starting to see that ultimately these are the compounds within the EPA and DHA that are helping with resolving inflammation. So taking a big step back, inflammation is really important when you have something acute that happens, for example, a cut on your arm. Your body needs to bring inflammatory molecules in to help repair that cut. Those are your immune cells ultimately. But at some point, it needs to stop the inflammatory pathway. And what we're playing with is, genetic components, epigenetic components, disease components for people that are continuing that inflammatory pathway. The pro-resolving mediators, these SPMs, are really important because they don't stop that initial inflammatory response that's required for life, but they help with the mediation of inflammation that's ongoing. So pretty cool new thing out there are these SPMs. And specifically when it comes to eye health, we've noticed that these types of SPMs derived from EPA, DHA are essentially seen to be helpful against inflammatory eye diseases, such as that dry eye and age-related macular degeneration.
Moving on to skin, we know that there are certainly cells, cell membranes with our skin that can be affected by these essential fatty acids, specifically having these omega-3s. So this is a study from 2021. What they did is they took those pro-resolving mediators that Dr. Rosalie was just talking about on this prior slide. And they broke them down and said, look here, psoriasis is affected by all three of these different inflammatory mediators that is provided in the omega-3. Atopic dermatitis is, affected by this one resolving mediator, the resolvin one. So we have the same sort of thing showing up in wound healing and then different skin cancers. So both malignant melanoma as well as squamous cell carcinoma have been shown to have be impacted by these omega-3s and be protected. We have a protective mechanism for going about addressing these. And then same thing with UV radiation, and that's an important one for folks that are ongoing with certain forms of oncology care, cancer care.
So here, a 2019 study on fish oils and bone health, specifically in osteoporosis. And this was actually a mouse study where mice were fed a diet with either 1% of concentrated fish oil or 4% of concentrated fish oil. So if you could imagine of all the calories in the day, that's your distinguishment, is just the 1% or the 4%. And what they found was that the mice that had 4% of fish oil in their diet were very good at maintaining bone mineral density during the aging process. And mice don't live very long, which is why we use them as a scientific study. But what an interesting finding here is that I think this essentially points to this idea of the omega-3 to omega-6 ratio being paramount in figuring out, okay, how do we build healthy cells?
And to bridge off of that, there's also really interesting studies about that omega-3 to omega-6 ratio being an indicator that's considered a reversible number that affects risk for breast cancer. So that's pretty wild too. So we have such a big impact from this ratio of omega-3s to omega-6s. We want more of those omega-3s to be coming in than they standardly are in the Western diet. So speaking of hormones and that with that comes fertility, as we're thinking about things like breast cancer. These omega-3s we see here in this study that just came out here in 2024 in April, just a few months ago, really do affect our hormonal regulation and specifically have a pretty big impact on fertilization rates as well as pregnancy outcomes, and how, the rates of effectiveness for women who are undergoing things like IVF and artificial means of becoming pregnant. So this was looked at as a meta-analysis, and they're looking at these omegas coming in from either supplements or dietarily, making sure these women are getting enough omega-3. So it's something important to think about when we're thinking about hormonal balance, not just thinking about other tissues.
So I'm sure this all has left you feeling like, what is my omega-3 to omega-6 ratio? Well, there is a test for that that we can do. So ultimately, this is one that I'm really starting to add into my practice as of recent, is just getting a check for what is your actual level EPA in the, essentially what it looks like is the red blood cell membrane. What percentage of the phospholipids are EPA? What percentage is DHA? What's the percentage are these other omega-3 polyunsaturated fats versus the omega-6, that arachidonic acid? It's reported as a total of fatty acids, and it's reported as a ratio, omega-6 to omega-3 ratio. So what we like to see is a ratio of those two that are approaching 4-to-1, or we'll say one, like absolute best would be 1-to-1 ratio, meaning omega-3s and omega-6 are a 1-to-1 ratio. Our current diet, that's very high in kind of grain-fed everything, ends up being something like a 20-to-1 ratio as of current. So the standard American diet, omega-6 to omega-3 ratio, 20-to-1. Certain of my patients, to get their inflammation under control, we need a 1-to-1. And I'm looking for my optimals being more like a 4-to-1 ratio. Especially if there's any sort of inflammation we're trying to get in check. So this is a really excellent, excellent lab to ask your primary care physician to order. And like I said, we also do it here at Prosper.
So, and what we find from the literature is when we're trying to correct these numbers, if they come back where those omega-6s are really way too dominant, is it takes about 4 months of supplementation with omega-3s, whether it be from diet or with supplementing to correct those. And that comes from some tissue studies where they're doing biopsies for people to look at how their cell membranes are, how long it takes their cell membranes to incorporate that fish oil. So if you've started a fish oil, just think like it's going to take a few months to truly have an impact and have that actually, assimilate in your body. We do have supplements that we offer through Prosper's Apothecary, both online. You can access our store through our website or in person here in Port Townsend at our clinic. And these are all physician-grade supplements that we have really curated to choose what we think is going to be most effective for our patients. There are different considerations when you're thinking about buying these omega-3s and specifically fish oils or vegan alternatives of these. So remember, you're going to come up with the first decision, really, for most patients is, do we want a liquid or are you more apt to take a capsule because of the convenience or not having to deal with the taste as much, that kind of thing. So it really depends on preference there, but also can have to do with dosing needs. The truth is there's more bang for your buck. It's a better price per milligram if you're doing a liquid and not paying for the encapsulation process. For some people, they don't like the taste. They can't handle the oily feel sensation, and they would prefer to take capsules, or maybe they're traveling and don't want to deal with the risk of a liquid coming with them. That being said, if it is a good quality EPA, DHA product or fish oil or marine lipid product, and it's a liquid, it should not taste rancid. It should not taste foul. in that way. Okay. So if your fish oil doesn't taste good, it might be a time to either look at the quality or look at how old it is or think about how it was stored. You can do that little test on your pills even by opening them up and tasting them. If they taste rancid, throw them away. They're doing more harm than good potentially. The next question becomes, do we want more EPA or more DHA for what we're trying to really accomplish? And that's one of the reasons why we shared that earlier slide of the benefits and how they're generally broken down for the body with a dominance of the DHA. We really think head, brain, and eyes, so the nervous system sort of impact, whereas EPA, we're really thinking about more of that peripheral body, whether it be skin, bones, cardiovascular system, those kind of things. And then when we're thinking about vegan alternatives, we're sourcing those from different algae. And so just being aware that it takes quite a bit of algae to make up for the amount that you could get directly extracted from a fish oil. But what a beautiful option for some of our vegan patients, especially, or folks that don't tolerate fish for some reason. Now, the next thing to think about, of course, is if you are looking for a fish oil that's like a whole fish, like a cod liver oil, versus one that is made of several different fish. So this Pure Encapsulations EPA DHA Essentials is probably one of our most commonly prescribed fish oil capsules. And the reason for that is it's an excellent price, which is great for the fact that it's a very clean source. And then it's providing these smaller fish. So see how it's anchovies, sardines, and mackerel are the main ingredients here for these fish. So they're the smaller fish. They're going to be less associated with mercury and other heavy metals. And they also are going to provide a really nice amount of the EPA and then not a skimpy amount of the DHA, which is that more the brain derived one. This total is 1,000 mg, which is pretty standard. You'll see 1,000 mg per capsule for a lot of fish oils on the market, but you're really wanting to look at how much actual omega-3 EPA DHA you're getting. So the comparison to that is the liquid. And here you can see within 1 teaspoon of this liquid, you go all the way up to 4,600 milligrams. So that's over 4 times the quantity in 1 teaspoon of 1 capsule of the same type of oil. The same similar product also made from these, smaller fish. This one's going to provide us with just such a larger bolus, which is really important to have a larger quantity for some of our patients that are needing those anti-inflammatory effects for certain pathologies that they're dealing with. We also, carry cod liver oil, and this is one that is going to be we think of it more as like a whole fish form or a single fish form. So this is an extract of the liver of cod, and it provides some extra nutrients, which can be really critical for certain patients of the vitamin D and the vitamin A in combination. And it's a nice natural option for providing those nutrients for folks. The algae-based forms that we're typically providing, you can see here, this provides a total of omegas that's a little bit under that 1,000 milligrams. The total oil is over 1,000 milligrams, but remember, we're wanting to know how many actual omega-3s we're getting. So this, in comparison to our fish oil, is already going to start off as a base, like a little bit less than what our standard single capsule would be for fish oil. And this is per 3 capsules. Because remember, this algae is the food for the fish. So food for the krill or smaller things that the fish might be eating if they're not eating the algae directly. So this takes several more pills to get up to that therapeutic dosing, but it still is a beautiful option as far as being able to provide a nice hefty dose of that DHA and provide some of the EPA. As far as those really cool specialized pro-resolving mediators, the SPMs that Dr. Rosalie was introducing, remember, these are the derivatives of the active components that are providing that anti-inflammatory effect from the fish oils. And this is a really cool product that Designs for Health came out with a few years ago, and we've been using it with patients that really need that extra support for inflammation reduction. So this is just another way to go about this. Now, remember, it doesn't provide some of the other components of those omega-3s that are influencing the actual cell membrane structure. So we still need our omega-3s coming in either dietarily or with some kind of supplementation. But these add that extra layer of how do we actually resolve inflammation when it's become out of hand. And you can see that this is derived from anchovies and squid and sardines and mackerel and herring. So they're really trying to choose some of these, generally kind of smaller fish for a lot of these oils. So this
This bit. Thanks, Dr. Molly.
just a lot of
We
information about,
yeah.
the different oils.
We're taking a summer break on Doc Talks, and I hope you all get to have a summer break as well. Um, but ultimately, usually this is the time at the end of our Doc Talk where we talk through, okay, well, what's next? What are we looking at next? So we'll have a couple of months to brew that up for you guys. Now is an excellent time if you do have questions for us is to add those in the chat box, and we're happy to use these next 5 minutes as our question and answer session. As you think about your questions, I just want to invite you to give us a call here at Prosper Natural Health. If you have any further, if you want to explore this further in regards to your particular symptom picture, or if you desire some extra support and want us to look through your current supplement list. We're available here. We can easily do a 10-minute meet and greet for new patients. Those are free meet and greet options. So let's look at our questions here. Got a question that says, how soon before surgery should you stop fish oil? I've seen a varying amount of days recommended. Sometimes I see just a bare minimum of 3 days. Sometimes I see other surgeons recommend more like 7 days. That would be something to cross-check with your particular surgeon. I definitely would say at the bare minimum 3 days.
And I would say it also depends on what kind of surgery. So, bleeding risk of the specific surgery. And then also, if you're somebody who's on a really high dose, say 3 to 4 grams, maybe more, sometimes we go even higher for fish oils, then it's going to take a little longer to get some of that antiplatelet effect to calm down for the body. So that might be more like a 2 week sort of avoidance. And then, of course, there's genetic components too. If you're somebody who tends to have thin blood, or maybe you're anemic and have a higher risk of bleeding, that affects that too. So usually it's kind of an individualized recommendation, but like Dr. Rosalie said, I'd say 3 days to 2 weeks is kind of average. Really good question. We had a really great comment just saying like that, the supplementation of fish oils ends up being a fairly inexpensive and effective health way, aid for a lot of people. And I definitely will second that. And I also just want to always really give a plug into whole foods diets and really taking in that consideration of we can be getting these essential fats from our diet. And it does take some extra doing sometimes. And sometimes it's a little different than what our standard American diet menu is. But there are, inexpensive ways of making sure that we're getting fish into our diet, whether it's a can of sardines or, making sure that we are having some kind of fish fillet or something like that in our dietary rotation.
So if there's no further questions, we'll wrap up here and look for our emails if you're signed into our newsletter to clue you into what will be coming for Doc Talks in October.